friends, welcome again to Dr. Usman's Edu Trends. Hope you are all doing well. Friends, as we all know, patients infected with coronavirus have the most affected vital organ, lungs, which causes the patient to have difficulty in breathing and later complication causes pneumonia. Pneumonia has been found to be common in approximately 20 to 30% of hospitalized patients in coronavirus epidemic, and breathing support is very important in these patients. 60% of patients need high flow oxygen therapy or ventilators. Patients over the age of 60 years have been found to have comorbid conditions such as heart, lung and kidney diseases, diabetes and cancer. Patients infected with coronavirus have very low blood oxygen levels and normal regular oxygen supply will not benefit them. And patients begin to complain breathlessness and lack of oxygen or hypoxia. In such a condition, the patient is given mechanical ventilation. World Health Organization recommended 94 to 96% immediate supplemental oxygen therapy in patients with hypoxia. Friends, let us try to know what is tracheostomy. A tracheostomy is a surgical procedure that is performed in an operation theatre for 20 to 40 minutes by anesthetizing a patient in the hands of a doctor or surgeon. When a patient cannot take oxygen from mouth or nose through a normal face mask, a surgical airway or opening is made in front of trachea or windpipe and it is fitted with a hollow tube which we call it as tracheostomy tube. It is secured with stitches or tape and later help in supply of temporary or permanent oxygen to the patient. Doctors perform tracheostomy only in emergency situation when patient cannot breathe normally. Tracheostomy is not required when the patient can breathe on his or her own and it can be surgically closed. Let us see why tracheostomy is necessary. Due to the infection, the upper respiratory tract and airways are blocked due to secretion and mucus, and it becomes difficult for a patient to breathe. With the help of tracheostomy, we can bypass the blocked airway from the mouth of the patient to the lungs and deliver oxygen to the patient through safety and ease through continuous ventilation. In addition, later, breathing or oxygen can clear the pathways that are blocked by disease or secretions. Friends, there are some risks and complications of tracheostomy. Let us see what are they. When the patient's oxygen requirements are met with the help of a surgical airway, there are some risks associated with it. When a tracheostomy is performed in an emergency or in a very sick patient who cannot breathe on their own, the blood circulation, healing, reactions after anesthesia are different in each patient and there are a lot of chances of further complications. Patient may experience airway obstruction, damage to the larynx or voice box, bleeding or infection, air trapping in the tissue of chest, scarring, difficulty in swallowing and speaking. There may also be scarring of airway. Therefore, the doctor and only the doctor is the person to decide whether a tracheostomy can be performed on the patient or not depending on the patient's health condition. Friends, how does a patient recover after tracheostomy? Some patients breathe on their own after tracheostomy, but some patients need a breathing machine or ventilator and are placed in intensive care unit. The patient's trachea or windpipe heals within a week after tracheostomy. Therefore, thereafter, the doctor changes the tracheostomy tube every week. After tracheostomy, the skin surrounding the opening is cleaned regularly, which protects the skin from moisture and skin rashes. The surgical opening and tracheostomy tube is protected from water and expected infections. The tracheostomy tube is changed every 15 days to 3 months. Debris and mucus from tracheostomy tube or mask are cleaned regularly by suctioning, due to which shortness of breath and coughing are more common in some patients. Patients who are fitted with a tracheostomy tube may need further help by oxygen tanks, ventilators, portable suction machine, disposable suction catheters and saline solution. When the patient recovers, there is no need of tracheostomy tube and the patient is taught to breathe on its own with the help of physiotherapy. Later, the surgical opening gets healed and closes. So friends, after watching this video, you all got to know about tracheostomy and I hope this video is informative to you all. If you really like this video, then do like and share and do subscribe my channel. Thank you.